Hello and welcome to a special Women's World season highlighting gender-based violence prevention and response in Papua New Guinea. In this special edition, we look closely at sexual and reproductive health. We discuss family planning, engaging men in family planning, safe pregnancies and sexually transmitted diseases. With that, we visit Kaugere Clinic in Port Moresby, where we talk to Dr Patrick Koliwan.
1 in 5 of our new booking mothers will be in their teenage years. A lot of these are from relationships which are not formalized or recognized by the families, so a lot of them will come without any kind of family support, so they'll come on their own. There's a lot of anxiety surrounding the pregnancy, a lot of misinformation about when do I come for my pregnancy, what are the important months, what are the important signs to look out for, when should I start thinking about getting ready for delivery. Excuse me. My name is Patrick Koliwan. I am the medical officer attached to Kaugere Health Center. Kaugere Health Center is a partnership with NCD Health and the Foursquare Church. We're located down at the junction between Kaugere and Badili, where we are a primary health care provider. So we provide a whole range of services right across the full spectrum of primary health care. So that includes outpatients, we do maternal and child health, so immunization, family planning, antenatal clinics, as well as a TB clinic we operate as well. And also we have voluntary counseling and testing for HIV and other STIs. We have one of the highest rates of maternal mortality in the world. So this is deaths due in and around pregnancy. So that's one of the main things. That's one of the main points of the antenatal clinic. It's to identify and screen for risks during pregnancy. These can be due to blood pressure, bleeding during pregnancy, growth restriction due to pregnancies that are too close together. And aside from the medical problems, we do also see a lot of cases of domestic violence during pregnancy as well. So women that are coming with a lot of physical injuries, which can have terrible effects on the pregnancy, such as bleeding during pregnancy, especially as a result of some form of physical violence. But we also do see a lot of emotional violence as well. A lot of women can suffer from depression during the pregnancy due to violence in the home, all forms of violence, physical as well as emotional. Kind problem is a come up law. Pregnancy time. PNG, you may get them highest rate blow all mama is a dial or bell time. Bell time na karem time. Because lo plenty kind problem. Blood is short, only karem lo place where no got nurse, also losing plenty blood. Especially lo city or mama sa kisim high blood pressure. So that's why antenatal clinic is important straight. Blow, you may check him, all get something, you come, you may check him weight, height, check him blood pressure. You come go inside, you may walk him HIV test, VDRL test, come go inside, me measure him bell, make sure all get a moon you come, baby you walk low, grow low mark, sign up low scale, make sure weight you walk low, go on top every visit. And blow look him all same, oh all get something straight. So suppose sample something you know alright, you may survey all same bell time do you and me got him risk. So then you may can give him your advice. Oh you look him lick blood, come hurry up to clinic. You feel him headache, you feel him eye round, come hurry up to clinic. We offer a wide range of family planning services here, mainly targeted towards women. So these are all hormonal hormonal forms of contraception. So we have the depot injection, we have the implants, and we also provide the combined oral contraceptive pill. Those are hormonal forms of contraception that we offer our moms. We also offer barrier methods as well. We give out free condoms for both men and women. At the moment, we don't do IUDs. We used to, one of our nurses used to put in, it's called a copper loop into the uterus to prevent conception. We have designated days for family planning for ladies to come in, so that's Wednesdays and Fridays, but we offer family planning at every opportunity. So if a mother comes in for something else, such as an immunization, or she's sick, or she's coming for TB clinic, or if she's coming for counseling and testing for an STI, and we always offer, and we give them at the point of care. In terms of young people's access to contraceptives, I'm not sure if the schools in our catchment area actually have a program for reproductive health, which encourages safe sex and family planning, that sort of thing. So we don't get too many school-age kids coming in and that sort of thing. They usually come in when it's too late, when they're already pregnant, and then we try to counsel them about further pregnancies and that sort of thing.
Welcome back to this special Women's World season highlighting gender-based violence prevention and response in Papua New Guinea. We continue with the topic of sexual and reproductive health. There is much fear and stigma and discrimination surrounding sexually transmitted diseases, or STI. In this segment, we talk to Sister Loretta at the Kaugere Clinic about the importance of having an STI check-up.
I normally tell them that in the past, people used to feel scared of it, but now STI is everywhere and anywhere. So we used to have small children coming with it, and a lot of the general population, even married men and women, they are coming in. So it's a part of us too, so we have to be treated. And everything that you say, it's really confidential, so you can feel free to tell me anything and everything about you. I'm Sister Loretta, and I work at Kaugere Clinic as a GBV nurse and STI nurse. I see both females and males as well as small children. I examine them, I treat them, and I refer them if they need to be referred. Mostly I see a lot of IPV or intimate partner violence, men beating their wives and partners. I also see sexual violence for children and adults as well. Some males too, who are raped, they also come to get our services at the health center too. Okay, for all the rape cases that we see, if they present themselves at the clinic before 72 hours, which is 3 days after the incident, then we see them. We treat them for other infections like STI. We also give them the PEP treatment for HIV/AIDS to prevent them from getting HIV, and we also do a pregnancy test, and we give the pills to prevent any pregnancies if they are women. For SV cases, most of the times for small children, I think it's the perpetrators are like family relatives or some people who are known to them, who are living with them at the same house. But for like adults who come, the perpetrators are like unknown people that, you know, they rape them on the streets or somewhere that they go and all this. So, yeah. For small children, it's like mostly known people in the house. Okay, for all these STIs, we have the treatment for them. So I do the examination, and I find out which type of STIs they are having, and I commence them on treatment. And then I tell them to come back for the reviews and all this. But at the same time, if they are like high-risk people, if they have a lot of partner during my interview, when I find out that they're having a lot of partners, I normally refer them to this clinic, the HIV site, for them to be tested for HIV as well. And they test them for VDRL, test for syphilis as well. And if they are positive for HIV, we refer them for further treatment and all this at Kila or Koki. They choose which clinic they want to go. And for positive VDRL, I normally treat them benzathine for 3 weeks.
You're watching a special edition of Women's World as we look at sexual and reproductive health. In this segment, Director of Safe Motherhood Alliance PNG, Catherine Fokes, tells us about how the organization works in terms of facilitation, coordination, promotion and advocacy of issues around maternal health, working from a community level to the national level.
Okay. Well, my name is Catherine Fokes and I'm the Director for the Safe Motherhood Alliance PNG. And the organisation was established in 2012 to work in a coordination, facilitation, promotion, advocacy role.
There is actually research that has been done that shows that during a pregnancy, violence can increase. When we're talking about violence between a man and a woman, a husband and wife, it's called intimate partner violence. So you may have never had a problem in your marriage or relationship, but at that first pregnancy, a problem may start. Some fighting may start. Pregnancy, as we know, a woman's hormones fluctuate up and down, up and down. But it's a time where it's new time. You know, there's a new life that's growing, new responsibilities, new commitments, and it can put a lot of pressure on a couple. And it can be the start of where the fighting begins.
So the Safe Motherhood Alliance was established in 2012 and to facilitate, to coordinate, to promote, advocate on issues around maternal health. Part of that has seen us go into communities and talk to communities about specific issues. Part of that has been to work with other organisations that work in the maternal health or the reproductive health field. And we're all working together towards a cause. So we believe in collaboration, that together we can achieve our unanimous goals. We also work as the Secretariat for the Papua New Guinea Parliamentary Group on Population and Sustainable Development, which is a long name, but it is a group of parliamentarians who voluntarily have membership in that group who are interested in population and development issues. And maternal health again falls in under that category. So you have members of parliament who are interested in the health and the well-being, and it's not just the women, though it is the women who often are the ones who will die from a pregnancy or a childbirth complication. But it's really a family issue. So for the health and the well-being of women and girls, we need to be implementing strategies that are effective. And the two key strategies are the provision of family planning and the ability for women to have their births supervised, so by a trained health professional. So that is a primary area that the Safe Motherhood Alliance works in, so across sort of community level, across an organisational level and a leadership level.
So where for 1 week, this one girl, she could not walk. So can you imagine not being able to walk because you've been beaten so badly? What happens to that baby? Fortunately, her baby, this was her baby. So this girl here, when she was very early pregnant, experienced incredible violence for that first period of her pregnancy. But the baby survives, she survived, and she was able to deliver a healthy baby. And her family came to accept that she was pregnant too. So I know that we're all here for a family planning clinic, and that's fantastic. If you don't want to become pregnant, you know, in a lot of the situation with these young girls, there's not access to having family planning because often you hear, you're too young, you shouldn't be having sex. But we all know there is enough sexual violence, there's enough, you know, when we're young and there's lots of hormones and we're in love, you know, what we should and shouldn't do, have we all never made a mistake? Young people make plenty of mistakes, they're young. But to talk about being able to protect a young person from having a pregnancy too early. I already said at the beginning, the younger the girl, the higher the risk for her surviving a pregnancy, surviving a delivery.
So we've had various programs that we have run that is all about talking about the issues, gaining commitments on the issues, and it's trying to facilitate to make projects, goals happen. One project that we have at the moment is called the 5 Mamas campaign. And that initiative is to try and inform the general public what are the key strategies that everyone can know that will help reduce the number of women dying in this country. So very briefly, it's good nutrition. So if a woman has access to good food, healthy food, proteins, greens, vegetables, fruits, before, during and after pregnancy, then it will help her body grow strong. To have antenatal care, so that's going and having pregnancy checkups at least 3 times during a pregnancy, because that will mean that she can be tested for any STIs, she can make sure that her baby is growing well, that she's healthy, everything is okay leading up to a birth, that she receives a supervised delivery, that if everyone knows what the symptoms of pregnancy problems are, then we can help support our women and girls, those who are important to us, to help them to reach a health clinic. And then, of course, we're talking about family planning. So if we have a baby, then there needs to be some space to help the mother grow strong again, to recover from a first pregnancy before she has another pregnancy. And of course, today it costs a lot of money to raise children. So with school fees and to feed and clothe and house them. So there needs to be obviously a decision made between a couple how many children they want, and family planning helps them to make those decisions possible. But family planning is not just for married people either. Family planning methods are for any person who wants to delay having that first child. So it means as a girl, if she wants to finish school, get a job or go to university, she has the ability to do that with protection. But also, it's not all about the girls again, it's about the boys too. The boys, if it's not the right time for them to have a child, then they also have methods available to them. It needs to be a discussion between a couple.
Thank you for watching this special edition of Women's World, highlighting gender-based violence prevention and response in Papua New Guinea. Coming up in the next special editions of Women's World, we look at empowering youth and adolescents. If you have a story to contribute, feel free to get in contact with us at womensworld@mtv.com.pg. You can watch this edition again on MTV Online at mtv.com.pg. There is also a radio version available for your listening on FM 100. We look forward to you joining us again here on Women's World. Until next time, from myself and the team, take care.